So hello everyone, let us discuss about the Inicet exam paper. So let us discuss the first question. If Hima is, the answer is that is blood in the anterior chamber. Now if Hima, it is presence of the blood in the anterior chamber of the eye, that is known as edema. So here is a diagram. So suppose patient having an eye injury suffer from edema, that is the presence of blood you can clearly see in this anterior chamber of eye. That is the space that is present between the cornea and the iris. So why does this condition occur? So this condition, it is generally seen, remember, it is generally seen as result of trauma to the eye, such as when there is a direct blow or injury, when there is a direct hit or blow. The second option, so when the blood vessels in iris or ciliary bodies, they are disrupted, it can cause bleeding within the structures. The first condition is hemorrhage within the iris or the ciliary body. So hemorrhage within the iris or the ciliary body, the term we use is, remember, it is intraocular hemorrhage, or we use is intraocular bleeding. The option B is blood in the vitreous humor. Well, the blood in the vitreous humor, as we know that vitreous humor, it is a gel-like substance. The last option is bleeding into the subconjunctival tissue. So here is the bleeding that occurs in the subconjunctival tissue. So bleeding in the subconjunctival tissue, that results in a red patch on white part of eye, that is the sclera, and it is known as subconjunctival hemorrhage, and it typically resolves on its own without any treatment. So that is why here your answer would be blood in the anterior chamber. That is the correct answer of this question. Now coming to the next question. The next question is an elderly bedridden patient who is on liquid diet experience aspiration that leads to respiratory complication. Which lung lobe is most likely affected? Now we know that aspiration pneumonia, it occurs when foreign material such as food or liquid is inhaled into the lungs. So when patient inhale the foreign material into the lungs, that leads to inflammation and infection. And remember that the right lower lobe is most common site for the aspiration pneumonia for the several reasons. Why? First of all, consider the anatomy of the right mainstream bronchus. The right mainstream bronchus, remember, it is larger in diameter and more vertical compared to the left mainstream bronchus. So when the aspiration occurs, particularly in the upright position, the aspirated material is more likely to enter into the right lung and settle into the right lower lobe due to the gravity. Now, the second reason could be the vertical orientation of the right lower lobe. The right lower lobe of the lung, it has a more vertical orientation compared to the other lobes, that make it easier for aspirated material to settle and pool into this area. So due to these anatomical factors, aspiration events, they are more likely to result in aspiration pneumonia affecting the right lower lobe. Now on X-ray, what would you see? And that is important part. First, in the case of aspiration pneumonia, you would see is lobar pneumonia. So this one is the right side. Right lower lobe is mostly affected. So sometimes the pneumonia that affects the entire lobe of the lung. So there would be the affected lobe that would appear consolidated, that is filled with fluid and inflammatory cells. Second, you would see the area of opacity. So here you can see is the area of opacity. So opacity refers to the area on the X-ray film when the normal lung tissue, it is not clearly visible. So in the aspiration pneumonia, the area of opacity, it may indicate the region of lung consolidation or inflammation due to the presence of the aspirated material. Other thing that you can notice is the segmental opacification. Segmental opacification refers to the localized area of opacity affecting the specific segments of the lung. Other important sign is air bronchogram. An air bronchogram, it is a radiographic sign where the air-filled bronchi, they are visible within the area of lung opacity. Other important sign is cavitation. So what do you mean by that? Here there would be formation of cavities or hollow spaces within the area of lung consolidation. So that may cause necrosis of the lung tissue, resulting in formation of cavities. So the answer here would be right lower lobe. Coming to the next question, one cartridge of e-cigar contains nicotine equivalent to how many packs of cigarette? Now let us discuss the parts of the e-cigarette. First of all, there is a mouthpiece. So mouthpiece is a part of e-cigarette that user inhale from. So it is also known as drip tip. So this is where the user choose the e-liquid flavor and nicotine concentration. Here they are contained. Second is the heating element. So this heating element, it is responsible for vaporizing the liquid. the e-liquid. So it consists of small coil. So here there is a small coil that heats up when activated and turning the e-liquid into the vapor. Other is there is heating element. Heating element that is responsible for vaporizing the e-liquid and turning the e-liquid into the vapors. Other component is microprocessor. Some e-cigarettes include microprocessor that helps to regulate various function of the device like the temperature control, power output, etc. And there is a battery. The battery that would provide the power to heat the coil and vaporize the e-liquid. Now what is e-liquid? E-liquid, remember, it is mixture that is used in e-cigarettes. It consists of propylene glycol, glycerine, nicotine, flavoring agent, etc. Now moving back to the question, the one cartridge of e-cigar contains nicotine equivalent to how many packs of cigarettes? The answer is 20. The nicotine concentration in e-liquid is measured in milligram per milliliter and it's 20. Coming to the next question, the inclusion bodies of adenovirus and poliovirus, they are known as, well, the inclusion bodies, they are the intracellular structures that are formed by certain viruses. The inclusion bodies of adenovirus and poliovirus, they are known as Cowdry type B bodies. So these are the inclusion bodies seen in infection that are caused by certain viruses, including adenovirus and the poliovirus. The Negri bodies, remember, the Negri bodies, they are inclusion bodies that are observed in neurons affected with the rabies virus. The Warthin Finkadele bodies, they are seen in measles. The Haynes bodies, remember, they can be seen in glucose 6 phosphate dehydrogenase deficiency. That is what you have to remember for your entrance exam. So remember, Cowdry type A bodies, they are seen in varicella zoster and herpes simplex and yellow fever. And Cowdry type B bodies, they are seen in poliovirus, adenovirus and cytomegalovirus. That is important part that you have to remember for your exam point of view. At what age mesoderms should be extracted? The answer is the mesoderms, they should be extracted as soon as detected on the radiograph. So remember that the mesoderms, it should be extracted as soon as detected on the radiograph. So mesoderms, we know it can cause eruption problems for the adjacent permanent teeth. So early removal can prevent the impaction or misalignment of these teeth. If mesoderms is not removed promptly, it can cause crowding, misalignment, so it should be extracted as soon as it is detected on the radiograph. So leaving a mesodense in place can sometimes can cause resorption of the roots of the adjacent teeth. Coming to the next question, the H2 receptors antagonist, that are the H2 blockers, they act on which cells of the GIT? The answer would be parietal cells. So H2 receptor antagonist, they are also known as H2 blockers. They are indeed drugs that are used to block the action of histamine on the parietal cells in the stomach. So binding to its receptor on the parietal cells, these medication reduces the production of HCl. So that is beneficial in treating various acid related GIT conditions like GERD, peptic ulcers, Stillingen-Ellison syndrome, etc. Now remember, the H2 blockers they causes histamine release. So remember, this histamine, it is relieved from enterochromaffin cells in the stomach lining. The binding of histamine to the H2 receptor activates the enzyme CAMP. So activation of the adenyl late cyclase increases the level of this CAMP within the parietal cells. So in this increase, CAMP activates the protein kinase. Now activated protein kinase phosphorylates and activates the hydrogen potassium ATPase pump on the luminal surface of the parietal cells. So the proton pump exchange potassium ions from the stomach lumen within the hydrogen ions from the parietal cells, that leads to secretion of the HCl into the stomach. Now, what are the action of these H2 receptor antagonists? The H2 receptor antagonists like ranitidine, famotidine, cimetidine, they binds to H2 receptor on the parietal cells, blocking the binding of the histamine. So there is, by blocking the histamine, that prevents the activation of adenylate cyclase, leading to reduced amount of CAMP. And due to that, there is a decrease in the secretion of the decreased production of the HCl. So for the question, the H2 receptor antagonist act on which cells of GIT? The answer would be D, parietal cells. Coming to the next question, plateau like bony margins, they are seen in which type of bony defect? The answer would be craters. So suppose this one is the normal bone contour, and in the craters there is so this, remember this, plateau stage boning margins, they are seen in the craters. So what are these? These are the concavities in the cleft of the interdental bone that are confined within the facial and the lingual wall. And remember, these craters, they form around 2/3 of all mandibular defect. The interdental areas, they are more prone to accumulation of plaque and are more difficult to clean. That leads to increased risk of periodontal disease and bone loss. The normal flat or even the concave faciolingual shape of the interdental septum in the lower molars may also favor the crater formation due to the anatomical factors. So the answer would be D, craters. Coming to next question, cholesterol is used for biosynthesis of all except. The answer is thyroid. Thyroid hormone, we know it includes T4 and T3. And these T4 and T3, they play an important role in regulating the metabolism, growth and development. The thyroid hormone, we know they are synthesized primarily in the thyroid gland from the amino acid tyrosine and iodine. So the process of the thyroid formation synthesis, it involves the incorporation of iodine onto the tyrosine residues within the thyroglobulin. The vitamin D, it is derived from the cholesterol. The cholesterol, we know it serves as a precursor molecule for synthesis of the vitamin D, specifically D3, that is cholecalciferol. So when the skin, it is exposed to sunlight, remember, UVB radiation convert the 7-dehydrocholesterol, a precursor that is derived from cholesterol, into pre-vitamin D3. So vitamin D is derived from cholesterol. Steroid hormone, cholesterol is a precursor molecule for biosynthesis of the steroid hormone that includes glucocorticosteroids, mineralocorticosteroids and the sex hormones. So the glucocorticosteroids such as cholesterol, they are involved in regulating metabolism, immune response and the stress response. The mineralocorticoids like the aldosterone, they regulate the electrolyte balance and blood pressure. The sex hormones include testosterone, progesterone. So steroid hormones, they are synthesized in the various endocrine glands including the adrenal cortex and gonads, and they are derived from the cholesterol through series of the enzymatic reaction. The sex hormone including androgens like the testosterone, estrogens, they are synthesized from the cholesterol in the gonads. In a male, the testosterone, we know it is primarily produced in the Leydig cells of the testes, and it is important for development of the male reproductive organ and secondary sexual characteristic. Remember, in the female, estrogen, they are primarily produced in ovarian follicles and involved in regulating the menstrual cycle promoting the development of the female reproductive organ and maintaining the bone health. So the cholesterol, it is used for biosynthesis of all except the answer would be here thyroid.